Well, first of all, it's correct that I work at Mercy as a clinical dietitian. I've actually, as of September, been there for 30 years. That was not part of my plan when I got out of school. I grew up outside of Manhattan on a farm ranch and went to K-State. It took me a couple of years before I decided that I wanted to go into dietetics. I had been in 4-H. I did foods classes and did the little demonstrations and all of that. But as I got into my education, I realized how much I really liked the medical field. And I also liked food, so I just started, an uncle of mine is a physician. So I started thinking, wow, dietitian would be really great. And so I just kind of, fell into that. And I definitely knew, even before I did my senior year of management and clinical, that I wanted to be a clinical dietitian. I'm really glad I had that management experience. But again, I knew that I wanted to do clinical. And so then I also knew, despite me having a boyfriend from Manhattan, that I was going to go wherever I could get a good job. If he wanted to come along, great. If not, that was going to be the way it was. So anyway, my very first job interview was at the VA hospital in Leavenworth, because my aunt, who had worked at Fort Riley for years, said, you need a government job. It's okay to be a dietitian. Well, I went there and went into the lobby, to find out where I was going to have this job interview, and there were these elderly men sitting around in the lobby in all different stages of, I don't know what, playing guitars and mumbling to themselves. And I honestly don't even remember if it was a man or a woman that interviewed me. I left there thinking, I'm just going to have to tell Aunt Bonnie, regardless of how good government jobs are, I'm not going to be able to work at a VA hospital. So then I started pursuing, a private hospital, and I ended up in Tulsa, Oklahoma. And as it turns out, 3 other dietitians from K-State, from the dietetics program here at K-State, also got their first jobs at a Tulsa hospital. 2 of us were at St. Francis, 1 at the osteopathic hospital, and 1 at another hospital in the downtown area. And so I just felt like it was a really special time. We had that connection. We weren't great friends when we were here, but we soon became good friends. But I ended up, after 4 years, marrying the guy from Manhattan, and back I came. And initially I worked part-time, and then through the years, the job grew along with that. And again, initially I started out pretty much just doing clinical, just strictly nutrition assessments, whatever kind of counseling was asked of us, or what was indicated for the jobs. But a lot of our work, and I forgot to bring it in. I have a couple of talks to give tomorrow morning to some education students. We didn't have, I know guys, this probably sounds just like so far back that you can't even imagine. Packages didn't have labels on them like they do now. A lot of a dietitian's time was somebody coming in, wanting our help, like with, say, on sodium, like how much sodium am I getting in my diet? So we had our handbook 8 from SDA with all, with all the listing of the foods, and it was in, 3.5 ounces or 100 grams. And you had to go through that book, food item by food item that they had consumed, and look up for them how much sodium or how much cholesterol. And now, of course, we have it right on the label, or for those of you with smartphones, you can scan it, and it tells you, like if you want to log it in on MyFitnessPal or Lose It or one of those programs, and how much you consume, it just automatically then goes onto your little diary for the day. And so a lot of our work that was done then has been automated or taken care of, like I say, by the food labels. So that was a big change for us. But the overall concept that has stayed the same over the years, people need us. They need help with their eating more than ever, really, than before. And you know, I was looking back, again, partly because of the talks tomorrow, but about obesity. When, even in the 80s, because I mean, I graduated in 75, guys. I mean, years ago. The obesity rate was only, not even 20%. No state out of the United States even had anybody with 19%. Well, now, you know, the average is more in the 30s, and I think the highest is Louisiana, and it's like 36% of people living in Louisiana are obese. So that's been the big change, and a little disappointing for me because through the years, I've always worked with a program that the hospital had on helping people lose weight. And I'm thinking, wow, we must not be doing a very good job. Something's not right here. But it's just, you know, there are so many factors that influence why we eat and how much we eat and how much activity we get or don't get. Mercy had a fitness center for about 12 or 14 years, and that was one of my favorite jobs that I had, was like working there, counseling clients. Initially, that was just a free service. If you were a fitness member of, you know, of the Mercy Fitness, you got free counseling, like a 15-minute session, and we measured body fat. We used the near-infrared machine for that, and so that was a really rewarding part of my job because those people wanted to be there, whereas the ones in the hospital, they may appreciate your help, but a lot of them didn't really get there by choice, you know. The other part of my job that I really did enjoy also, and you know, Amber, if you were here when Mr. Allen was the CEO of the hospital. Mm-hmm. Well, prior to our current CEO, we had one that had very grandiose ideas, very visionary about the facility and the role that the hospital played with the community. He was very pro, get out there. He wanted us involved in lots of different functions, even if it meant putting us in overtime. He wanted us out there. Well, then a lot of, you know, the economy changed, reimbursement changed some, and we just couldn't function like that and keep in the black. I mean, we soon became in the red. So that was a very hard shift to make when that pendulum swung back to where we had to really cut that stuff. And I think that's probably been one of the more challenging parts of my career, when we no longer were doing all the community things, because you somewhat, you know, how similar to as you're growing up and you get more and more privileges your parents give you, and then that's great till you do something that they ground you. It's so hard to go back, you know, to not having those privileges. And so, you know, we're slowly adjusting, and we still feel that we're certainly needed in our jobs. It's just that we're really focused on, is this going to, are we going, you know, to at least break even? Hopefully we're not going to be going in the red for some activity that we're trying to do. But one of the other parts of my job, besides doing like the community events and working with fitness members, is we developed a program, a bariatric program, both a lifestyle and a surgical component to it, about 6 years ago, and that has just been amazing. I'll pass these around. These are our current brochures for our program is called Mercy Light. It's physician directed, which means that we're billing for our service under a physician, so reimbursement's a lot better. There's a better chance of being reimbursed for what we do than if they just come in and see me as a dietitian. That really varies. Some insurance companies will pay for it, some will cover so many visits per year, others won't cover it at all unless the person has diabetes or kidney disease. Whereas with it being a physician-directed program, the reimbursement's much better. Along with our physician, we have a couple of psychologists, and that has been really, really helpful because a lot of people have underlying issues on why they eat or why they just think about themselves and their goals. And I felt like I knew quite a bit about overweight people and maybe challenges that they had, but really nothing prepared me for the stories that I would hear as these people came into our program, just in terms of, the full gamut of whether it was being sexually abused as a child to, somewhat abandonment by parents, or teasing in school, or a really smart, like I'm thinking of one of our clients who is just a slightly lower intelligence, and she said compared to her siblings, she was the youngest, and compared to her siblings, she always felt like she was the dumb one. And a lot of times just sad stories, where they can go through their whole day without somebody making eye contact with them. And so again, it's been great to have the two psychologists. Many, many times we recommend to someone that they get additional help, with whether it's depression or anxiety, or we see a lot of binge eating, especially in the evenings. And again, I think our culture is such, people are stressed at their jobs. Many times they're overworked. They may not have eaten very well through the day, and then they get home at night and they're just really, really hungry. So that's a big part of my job right now. In fact, I spend more hours in our weight loss clinic than I do at the main hospital. Have any of you shadowed a dietitian yet in a hospital? Some of you have. Here in Manhattan or elsewhere? Like where's
I did here, Leslie Graves.
Yeah.
This summer.
Okay.
Mm-hmm.
And did you?
In St. Francis Hospital in Wichita.
Okay.
At the Kansas Heart Hospital in Wichita.
Who else raised their hand?
I was at Children's Mercy in Kansas City.
Oh, okay.
I did at Cincinnati Children's in Cincinnati.
I think that, if you're thinking you want to do clinical, and you all have probably talked about this before, I really encourage people, try to get out there and shadow a dietitian just to see, what a day's like. One of the great things about working in a clinic with a physician, you accomplish so much. It is just, oh my gosh, you just go home, you're just like on a high. You really are. Because you're not having to call the doctor's office, asking to talk to the nurse, to have the nurse talk to the doctor, and for them to call you back before you get something decided. Doctor's right there. You ask the doctor, you get it done. And especially Dr. Dobek, the female doctor in the brochures, and I apologize if I didn't bring it up. I should have asked JC how many of you would possibly be here. She is one of these, if you said, I want to join a fitness center, or let's be more specific. If you said, okay, I want to hire a trainer at the rec, she would say, okay, well before you leave, you're going to go in my little office and sit down with the phone, and we're going to make that call. And she helps them do this, whether it's the insurance company or if somebody, for instance, there is a counselor here in town, and I don't know if you guys ever have anybody come from the mental health side of it, but Heather White-Brighton is a counselor. She's a counselor that did work at an eating disorder clinic in Kansas City, and she and her husband and family moved here to Manhattan. So she is the person that really we refer people to that have some type of disordered eating, the binge eating. And that's really, really great to have her. So again, if it's a counselor or something like that, Dr. Novak will say to them, okay, we're gonna, when you finish talking to Teresa, then we'll go in my office and we'll make that phone call. And again, helping that person not really have the chance to procrastinate on it. They say they're there and they're wanting to make changes to lose weight. And by far, the majority of them tell us they want to lose weight to be healthier. Because, when you're my height and weigh over 300 pounds, it's pretty hard, to go up the bleachers to see your grandkids play at a sporting event or something. Or, do the grocery shopping. Many of these people have to have their spouse or somebody else or ride a motorized cart or something like that. And they, again, just feel like their health is really limiting what things they get to do, whether it's going to Disney World, go on some kind of vacation with their spouse, or just day-to-day things that we take for granted. I know one of the things that I jotted down that even back when I was in school, evidence-based practice was what we learned. But again, much like with what's in a food product, how much harder it was to find out what it was, we had to go to the library and look up the journal, find the journal and look it up. Whereas now with the access online, again, it's just so much easier. And it's, for instance, our hospital now has the Da Vinci robot that the surgeon uses to assist on some of the surgery cases. And sometimes there's an unplanned event with that. So Dr. Novak and I wanted to look up how that compared with laparoscopic. Because you know how you've gone from having, like if say you were having your appendix taken out when I was a kid, you would have a big incision, right? To now they do just the 5 small incisions to do it laparoscopically. So you're up and around later that day or the next day for sure. To now this Da Vinci robot incision, there's typically just one. And so what we found was, much like when they went from open surgical procedures to doing it laparoscopically, they had some unplanned events, meaning they nicked a bowel or some other, something was cut that shouldn't have been, or they left part of something or whatever. Well, same with the Da Vinci robot. That again, there's this learning curve that initially there are a few more unplanned events compared to the laparoscopic. So just things like that that make it great. You can, like I say, read the latest to know how you compare with other hospitals and so forth. One of the fun things that I've done in my career, I went to some, it was not a craft show, but it was an event for women. Just only women could display their items there for sale here in Manhattan. There was a young woman there who had cookbooks, and I picked one up. But I noticed it did not have the nutritional the nutrition facts for any of the recipes. And so I laid the cookbook back down, and she said, "Oh, is there something you were looking for?" And I said, "Well, to be honest, I'm a dietitian, And I just don't buy a cookbook unless it at least tells me how many calories per serving. And she said, well, I don't know how to do that. So I just said, well, you know, if you're interested, let me know. And I'll help you with that. Because I said, I really think you would sell more of them if you had the calorie content. So I gave her my name and phone number, and it was about 2 weeks later she called me and she said, you know, I'm really interested in that. And so, could we meet and figure out how I'm going to do this? So we decided that, and this was like about 5-6 years ago now, that of course the weight loss approach would be the way to go. She had several that were more just comfort food cookbooks. The very first one she did actually was just like family recipes. And so I helped her get reasonable software. She was able to find that used, I believe it was the USDA database for their nutrition facts. And so the one part that I messed up on though was, in order to promote it at the hospital, I can't make any money off of it. So when she asked me, do you want so much per book or do you want so much per hour? I said, well, I would like to be able to promote it at my job. So I'll just go with the so much per hour. So for a series of months, we met at Panera. She brought her laptop. We would sit there and work for an hour or two. Never expecting her to be selling a whole bunch of these. Anyway, but she's had quite a good success with it. We also, I suggested that she try to have as many of them heart healthy, so we incorporated the Heart Association guidelines. So if there's a heart on the page for that recipe, it means it's heart healthy. But what I did learn, I felt like I was a little bit behind on the technology part. At least now I know if I were to do a cookbook, I know how to do it. I know the software. I know where she gets them printed right here in town. So that was a really fun event, and you can take a look at this. And so I just think with a career in dietetics, you just don't know for sure where it's going to take you. Even if you just like with me, and basically hospital focused. But like with this project, it was a really fun event. And I still, I got paid a decent wage for the hours that I put into it. And I just feel like there are just so many opportunities, whether it be, with a church or with, like here in Manhattan's, also a free clinic, if you're wanting to do that. Through the years, we've had dietetic students, including Amber. And many of them have gone on, whether it be, sports nutrition, WIC clinics. I mean, it's really, there's no limit to what you can do. One of the projects that I did just for fun was, it was a few summers ago. Gatorade used to have a big push for about preventing dehydration during the summer. And so I contacted the Gatorade company and had them send me brochures and water bottles that I provided to the little Apple Day Camp. And then I invited Manhattan Mercury News reporter to get involved and to do a story. Well, I mean, it was not so much because of who I was or whatever. I think it was just good timing and they needed the space. But they did an entire page about this preventing dehydration. So I ended up, after it was published, I sent it to the Gatorade company. And then it just happened I was going to FinCity later, that fall. Well, those same people that I had communicated with by email or by phone were there at FinCity. And they're like, oh, you're the one that did the newspaper article. And they were just so thrilled, to meet me as well. And so there are just a lot of little, diversions from your job that I think you're going to find so rewarding, and that you just will be really proud of the work that you do, and it'll be something you can do with or without a family, full-time, part-time, or whatever. So, do you have questions for me? Or comments, or a story you want to share with some project that may have not been one expected?
You go first.
What is the I'd say, what type of demographic do you usually see for your clientele? Or what kind of age group?
Well, the majority of our weight loss, you mean as far as the weight loss clients or patients overall?
Just overall.
Well, certainly hospitalized patients range tremendously in age, but they're probably more the 40 to 90 age group. Some of the younger ones, it might be Crohn's disease, something that they really didn't have anything, they didn't do any, their lifestyle didn't cause it. Whereas some of the younger ones, their lifestyle led to, whether it's alcoholism or possibly diabetes, that they didn't care for themselves. But of course, we do see a lot of older folks that it's just they've lived a lot of years, and so in the hospital it varies a lot. As far as our weight loss clients, again, most of them are probably more, say, 30 to 65 age, although we're getting more and more older patients, partly because, again, they're living longer and they want to be active. About 80% of them are women, and about 80% of our weight loss clients choose lifestyle, and only about 20% choose surgery. Although we're getting more and more surgical patients because Dr. Seville, the surgeon shown there in the brochure, now not only does the lap band and the gastric bypass, but the gastric sleeve. So it's somewhat a good compromise between the two surgeries, and really good weight loss results, but yet not the severe deficiencies that occur.
So how do you feel about them getting surgeries?
At first, I'll admit I was a little biased. Like, I don't think you guys are trying hard enough. But since that, again, there's knowledge that we have now that we certainly didn't have when I was in school. For instance, the hormones that regulate our appetite, ghrelin and leptin, we didn't know about. And so I am convinced some of these people have either they produce too much ghrelin, or else their body doesn't recognize the leptin when it's saying shut down, quit eating. I worked with a woman, she could sit down to a full meal, eat the whole thing, drink a bottle of, a 16-ounce bottle of water with it, and still be ready to eat more. She never felt full. Well, she had the gastric sleeve surgery, and for the first time in many, many years, she said she could feel satisfied eating like a reasonable plate of food and not wanting more. Some of these people, like one of the ladies here recently that does weigh over 300 pounds, she had to be on prednisone for some breathing issues, and that really, caused her to gain a lot of weight. So some of them, or some of these people are put on antidepressants that increase your appetite, and either the doctor is not aware or not aware of what impact it really has. So that's where having the physician on the staff, where that's their job to really look at those meds. So, then we'll have them call their primary care doctor, talk to them, or at their next visit say, I'm hearing that this Abilify increases my appetite. Is there something else I could take in place of that? And then that will help them, not just have this huge appetite all the time. It's a tool. It's not the whole answer, because we have people in our program that have already had surgery once and have gained it back. one of the things that we do with our program, even after their surgery, they're still to come into the lifestyle part every month for the first year. And so we're hoping to help them stay on track and just really have down pat, you know, how much exercise it's going to take, and food-wise, how are you going to get through these different, you know, holidays and so forth. I don't know how I feel about children. I think I just saw a 2-year-old that had a gastric sleeve. We tried even doing like an 18-year-old, but they were a senior in high school. That didn't work really well. So we do better with adults. I think young people have a lot of other interest, and I think it's hard for them to sometimes stay focused on all that it takes. Plus, like, most insurance companies require you to do 6 months of a lifestyle program before they'll approve you to have surgery, and you have to have a separate psychological evaluation. And if something's out of balance, and we've had a couple of people not be able to have their surgery because of depression, have been the primary factors. And so their surgery had to be delayed. But it was, you know, it was for the best. Any other, yeah.
Where did you say that you did your clinical semester?
Oh, where did I do my clinical? I did mine at Wesley. When I was a student, you either went to Wichita or Kansas City to KU Med. I was in the group that went to Wichita, and I was at Wesley. At that time, Wesley had a nurse's dorm. They had a nursing school. We stayed in the nurse's dorm and had our meals at the at Wesley Medical Center. And I happened to be assigned to a gastroenterologist there at Wesley. So my experience was a little different from the students that were either at VA or one of the other hospitals, because primarily we saw all GI stuff. But it was a very good experience. Yes.
I'm thinking that there are some patients gaining back the weight, maybe because they have the fat genes. Do you have the technique to attack this now?
Well, I know genetic testing's available, and yes, I can't tell you the source, but I do know that like an overweight man and an overweight woman end up marrying each other. So it is all, they feel that it is altering the gene pool, you know? And so, but at our program, really the only genetic testing that we recommend is if someone, you know how obesity is associated with an increased risk of cancer, certain kinds of cancer. One of our clients has both grandmothers that have breast cancer. She is concerned that she has the BRCA3 gene or 4 gene. So that was one of the phone calls that Dr. Donak had this person make, was to find out how much genetic counseling costs. But as far as like for weight, and whether they're going to have that tendency to gain weight back, we don't do that testing. Any other? Well, thank you all. I know you've had a long day, and I appreciate that attendance. And if anybody wants to shadow any of us at Mercy, you just can go to the Mercy website and go to the volunteer section. That is how it's handled. And then one of the great things about the weight loss clinic is that, for instance, every Thursday we're there all day. So it makes it easy if somebody wants to shadow a dietitian like in a clinic. And you don't always have the opportunity to get to see a physician. Because I think, maybe that's the part that can be a little intimidating. Some of the physicians may or may not share your same perspective about nutrition. And so the more you can be around a physician or a PA or a nurse practitioner to have that dialogue and gain some confidence. And, for instance, this past week, my hospital job, I was working with a patient who is on a tube feeding. And she also has cancer. And she didn't seem to tolerate her tube feeding very well. And she had an NG tube. The tube was down her nose and the back of her throat, instead of having what we call a gastrostomy tube, where it's put into the stomach. And she was only getting 50 milliliters an hour, which isn't even a fourth of a cup. 60 milliliters is a fourth of a cup. Well, it seemed like several mornings when they were night shift and day shift were getting her up, she would end up vomiting a little bit. So then they stopped the tube feeding and did some testing. Well, then the doctor wanted to switch from that continuous of the 50 every hour to doing what we call bolus feeds, but like a bigger amount. And I'm like, whoa, I don't know how this is going to go. I'm thinking, okay, how can I diplomatically say this? If she's not tolerating 50, I don't think she's going to tolerate 120 or 250 or whatever that's in a can. So I call the doctor up and I'm like, I'd really like to try this one more time at this 50 an hour to see how she does before we try to do more. It's like, well, I just don't think that. We've tried that twice now, and they call me every morning. Well, yes, I understand the nurses are calling you for help. So anyway, as it turns out, for whatever reason, the nurse, when I talked with her, because this just happened this weekend, I called in because I was just curious. She said she thought it was because it was tickling her in the back of her throat and eliciting that gag response. But anyway, I found out today that they ended up taking the tube out and started her on TPN. So I was sorry to hear. But it just depends. Like that patient had been at KU, they typically do an NG tube instead of a PEG. Whereas if somebody gets shipped to Wichita for something, they'll put the gastrostomy tube in, and the people seem to do well with that. So I know it's just a different, so you really have to present your best case, and you can't take it personally if they don't take your advice. And so I don't know, I'm going to be really interested in, I'm actually off a few days, but I'm going to be interested in talking to the doctor when I get back on, why do you think this was happening, So, anything else? All right, well, again, thank you so much. And best of luck, especially to those of you that are seniors and will be graduating in May.